4 million children in the U.S. have been infected with the coronavirus since the start of the pandemic, and there's concern that number will keep rising as students get ready to go back to school.
But health leaders have been putting out mixed messages when it comes to masking up in class. Our Cameron Thompson found parents in Virginia will soon have an answer from the governor on this debate. Cam?
Yeah, and Candace, the governor's office says that as he has throughout this pandemic, the governor will be following the science when updating the state's COVID-19 policy guidelines. And as of tomorrow, parents and school districts should be seeing updates to the masks in school policy.
A spokesperson for Virginia Governor Ralph Northam says the Departments of Health and Education will release updated guidance about wearing of masks in schools on Wednesday. It comes ahead of the current order expiring on July 25th, which requires masks regardless of vaccination status for anyone over 5 in schools. Earlier this month, the CDC said fully vaccinated students and staff don't have to wear one, but anyone unvaccinated over the age of 2 should. But Monday, the American Academy of Pediatrics says it recommends anyone over the age of 2 should continue to wear a mask in school, regardless of vaccination status.
Children's Hospital of Richmond at VCU pediatrician Dr. Tiffany Kimbrough says the 2 recommendations are complementary and have the goal of making it safe for kids to go back to in-person learning.
We've just seen how, the virtual learning, especially for our young kids, has had academic, emotional, mental health impacts.
Kimbrough adds the CDC says local officials can choose to go masks for all if their circumstances necessitate it.
Recognizing that variants are a possibility and that what's happening at the local level may not be the same as what's happening at the national level.
While on the AAP recommendations of masks for all, Dr. Melissa Vray says doing a masks for some but not others approach could be difficult to implement since not all school-age kids can get the vaccine.
If you have, if you're in a mixed age, you have 11 and 12-year-olds in the same classroom, how is that going to work? How are you going to make sure that you're being effective in your masking? And so from an implementation standpoint, it might just be better to go throughout.
Now, Dr. Vray adds that whatever the guidelines that come out tomorrow from the state are, they should be considered the minimum. And like we've heard, that localities should decide if they need or want to go further with the mask mandate.